So right now, 1 in 8 Kentuckians does not have enough food to eat. For children, that number is nearly 1 in 4. SNAP, which is the Supplemental Nutrition Assistance Program, is the strongest tool we have for fighting hunger, and it reaches every county in the Commonwealth, paying for over $1 billion worth of groceries every year. This is why we are so opposed to House Bill 367 and are sounding the alarm today. House Bill 367 would cut people off from SNAP in 2 different ways. The first is that it would cut the income eligibility limit from 200% to 130% of the federal poverty level and would reinstate the now waived asset test, which means households with SNAP would be penalized for having savings, family land, or even a family car. Together, these SNAP policies are known as broad-based categorical eligibility, or BBCE, which is the standard flexibility that Kentucky has long implemented alongside 42 other states and the District of Columbia to simplify public assistance program administration and to reward participants' work. Nearly all SNAP households in Kentucky use BBCE as a part of their application process, and while eliminating it would affect all of them, it would actually take food assistance away from at least 65,000 people, including 21,400 children and 4,400 seniors, losing over $110 million in federally funded food assistance annually. The second way House Bill 367 cuts access to SNAP is by preventing the state from waiving the work reporting requirement for some adults in areas with high joblessness. This would put an additional 16,000 Kentuckians' food assistance at risk, including adults in 8 southeastern Kentucky counties, which have never had to comply with this reporting before and have unemployment rates 25% higher than the rest of the state. Today, you'll hear from several different constituencies who will be uniquely harmed by this bill and these 2 ways that people will lose food assistance. We urge the state Senate to abandon this legislation and preserve a SNAP program that already works in our fight against hunger in Kentucky. Thank you.
Thanks, Dustin. Now we will hear from Kimmy Ishmael from the Community Farm Alliance.
Good morning, everybody. I am Kimmy Ishmael with Community Farm Alliance. And when you look at House Bill 367, you might think, what does farmers or agriculture have to do with this bill? When really the ripple effects of this bill will not only impact our farmers, but our local food system as a whole. And these unintended consequences could really hurt the growth of small farmers across our Commonwealth in many, many ways. And this includes hurting or impacting their businesses and sales by impacting their customer base, because many use incentive programs that allow them to purchase double their money at local markets. It's going to impact our local food economy, but also it will impact the possibility of a farmer, especially a new or beginner farmer, from accessing benefits in the future with the implementation of BBCE or the asset test. And we all know that in Kentucky, farmers are the backbone of this state, and we believe at CFA that they should be able to farm with dignity and feed the people who are hungry, but also have access to those benefits as well.
Thank you, Kimmy. Now we can hear from one of those farmers, Chelsea Barber. You're muted, Chelsea.
Chelsea, you're muted.
Hi, I'm Chelsea Barber, and I'm a young and beginning farmer growing vegetables year-round in Kentucky. Please let me assure you that food access programs like SNAP are paramount to my success in operating a viable and profitable farm business here in Kentucky. SNAP is a resource that fortifies the food purchasing power for the people of my community. And as a market vendor, I see SNAP customers consistently buying fresh and Kentucky grown vegetables. Just last year, nearly a quarter of our total farmers market sales were sourced from food access programs, just like SNAP. And that is a huge number for my small business. HB 367 will absolutely lower my sales. As a current farmer in former SNAP user, I know that locally grown foods must be available and affordable to all people in order to truly create a resilient and healthy world. SNAP is going to help us work towards that future, and we need to protect this resource, not strip people from it. Please care about this. Do not pass HB 367.
Thank you, Chelsea. Now Eric Evans with the AARP.
Yes, I'm Eric Evans, State Advocacy Manager for AARP Kentucky. We have concerns about HB 367 because it would disproportionately affect older Kentuckians. This bill would no doubt make it more difficult for Kentuckians to qualify for food assistance by ending the broad-based categorical eligibility. The BBCE provides a way to reduce administrative burden and also makes it easier for Kentuckians to qualify for SNAP. And seniors usually also have accumulated some mostly small assets that could lock them out of their benefits. If we do away with the BBCE, many older Kentuckians that aren't technologically inclined or have access to the internet may find themselves locked out of their benefits even though they qualify. Studies have shown that this could leave thousands of older Kentuckians behind that qualify for SNAP. We can give you all the numbers we want, but if you've ever volunteered at a food bank or Meals on Wheels location, it's obvious to see that most of the people you're serving are seniors. So there's no doubt that you would see this population greatly affected. In Kentucky, this population is already struggling with inflation and cost of living increases. Taking away this modest benefit of food assistance could really cause struggles in households across the state. We know many older Kentuckians are going to have to make tough decisions of deciding between paying for their utilities to keep their lights on, their high-cost prescription drugs to keep them feeling well, and now even more so their food to keep them healthy. ARP does not believe that changes need to be made to SNAP, and at this time we would like the Senate to oppose House Bill 367.
Thank you, Eric. Now we'll hear from Liz McQuillan with the Metro United Way.
Good morning, everyone. I'm Liz McQuillan. I'm the Chief Policy Officer for Metro United Way. And at Metro United Way, we advocate for policies that support thriving kids, strong households, and more equitable communities. As Dustin mentioned in his remarks, we know that 1 in 8 Kentuckians are food insecure, and that includes 154,000 Kentucky children who wake up every morning not knowing where their next meal will come from. One hungry child is too many, and Kentucky cannot afford to worsen this problem by decreasing access to SNAP for Kentuckians of all ages, which is what House Bill 367 will do. As you've heard, the impacts of this bill would cause a loss of supplemental income for food for thousands of working Kentucky families. The Kentucky General Assembly has recognized increasing workforce participation as a top priority, and at Metro United Way, we know that gainful and stable employment can have a multi-generational effect on households. However, House Bill 367 would have broader impacts that would shrink the labor force and worsen hunger and poverty by exacerbating the benefits cliff. This bill would actually disincentivize SNAP participants from earning higher wages or taking on more hours, as those earnings could place them over the lower gross income threshold. We urge the Senate and the General Assembly to consider the destabilizing effects that House Bill 367 will have on food insecurity for Kentucky's children and households. Thank you.
Thanks, Liz. Now we'll hear from Dala Emerson in Bowling Green.
Good morning. I'm unmuted, correct? Perfect. Good morning. My name is Dala Emerson. I'm the Food Service Director for Bowling Green Independent Schools, and House Bill 367 creates great concerns for us because our participation and our reimbursement for the meals that we serve our kids are solely based on free and reduced percentages and the broad-based categorical eligibility. Our CEP, community eligibility provision, also is greatly impacted by it. It may not impact us on this first year, but on the second year for sure, we will be seeing more hungry kids that are coming through our lines, that are arriving from the weekend at home of not having enough meals and needing more than just one meal. And our budget does not allow for that. So we're going to have to make hard decisions on looking at our babies and deciding, do we want to take a loss on a meal because we can't get reimbursed for more than one meal? We want to fight for our hungry kids. This bill is going to make more than 25,000 Kentuckian kids hungry across the state. It is a cruel bill that impacts not just our kids, but our workers as well. majority of my workers are also participants in SNAP benefits because they are not making a livable wage, and because they have a vehicle to get them to and from school to help me feed our babies, they're also going to be penalized, and the kids that they are taking care of at home will also be penalized. I urge our lawmakers to really think about our communities and think about our Commonwealth families and think of what's best for our families, because as you've heard, taking benefits away does not incentivize more workforce. It'll deplete it. It'll cause considerable harm to communities across our community, across our Commonwealth, and our children will be the ones that suffer. Our children will be the ones that have to pay, and our school systems will be left grappling with the effects of not having enough resources to take care of our kids properly. I urge that House Bill 367 not be pushed through. Thank you.
Thank you, Dala. Now let's hear from Tracy Pulley with Fulton Independent Schools.
Thank you. I have been the Fulton Independent Frisk Coordinator for 19 years now. And so I talked to our local food bank and asked how the numbers have been historically. The director told me that since 2010, the number of boxes being distributed monthly has gone up 400%. So she's giving out about 220 boxes a month now, and that number keeps rising. And it's important to compare that with Fulton County's population loss, where we've lost about 10% of our population over that 14-year period, that the food needs went up by 400%. Here at school, I distribute Feeding America food bags on Fridays, and I've done this for 14 years also. And this year I have a new problem. Children whose parents did not sign the permission form to get a bag of food on Fridays have been taking food, and so we've had to change the way we distribute the bags. And you all have to know that these are bags of instant oatmeal, cans of Beanie Weenies. It's not that children are taking the bags on a whim. They are taking them because they are hungry. And the parents here, they do work. Many of our families, our parents have 2 jobs, and they are still not able to buy enough food for their household to keep their children from being hungry. So please do not pass House Bill 367. Thank you.
Thank you. Now let's hear from Jay Brewer.
All right, good morning. My name is Jay Brewer, and for the past 12 years, I have proudly served as superintendent of Dayton Independent Schools, and I represent a low-income district that qualifies 90% of our students for free breakfast, lunch, and dinner. And I firmly believe that we as adults have a responsibility to take care of children. Actually, I believe that it is our greatest responsibility. As we look at House Bill 367, I believe we need to be asking, what are the outcomes for kids? I do realize the concern for addressing the issue of ensuring that everyone is receiving need is in need. At the same time, we need to make sure that the actions that we take don't have unintended consequences, and I believe House Bill 367 has several for kids. Reducing SNAP benefits for kids for Kentucky adults will result in schools losing federal funding for programs that feed and nourish our Kentucky kids. It's a bit complicated, but it comes down to the ability to directly certify families that qualify for food assistance, as you've heard from others here. The reduction of this direct certification route will result in not only the loss of funding for school breakfast, lunch, and dinner programs, it will also impact funding for our family resource centers that rely on this data for their funding to best support students and family. Reducing SNAP enrollment will have a domino effect to make fewer schools able to choose the community eligibility program that allows many schools to feed all kids at no cost to students. At a time when Kentucky kids are experiencing a health crisis and obesity levels are at national highs, we need to be looking for solutions for healthy Kentucky kids. A reduction in funding for our school programs will result in a reduction in the opportunity for kids to have the exposure to high-quality nutritional meals. For many kids in Kentucky, their best opportunity for protein-rich meals that include fruits and vegetables are within our Kentucky schools. We can't create a situation where kids lose the ability to have high-quality meals and are left to what I call the Little Debbie Dorito school lunch. When looking for solutions, we need to always be asking, does this work and does this help? What often works doesn't always help. House Bill 367 might work to reduce the number of people receiving public assistance, but it doesn't help Kentucky kids.
Thank you. Now we have Sarah Hall from Save the Children Action Network.
Hi, good morning. On behalf of Save the Children Action Network, the political voice for kids, I'm here to call on lawmakers to reject the passage of House Bill 367. HB 367 threatens to remove access to crucial food assistance provided through SNAP for families and children across the state. This bill, if signed into law, would severely reduce access for Kentucky families that rely on anti-hunger programs, especially in rural communities. HB 367, if enacted, wouldn't just be bad for children and families, it would also affect economic opportunities and livelihoods for people living across our great Commonwealth. 256,000 children in Kentucky participate in SNAP. Any reduction in access would have a devastating impact for the communities that need anti-hunger programs the most. Child care centers would also be negatively impacted by this bill and would have to make up for a loss in federal funding or stop providing meals. For thousands of families, the detrimental effects of this bill extend beyond SNAP, jeopardizing access to free school meals for children, bogging down application processes for public assistance programs, and leaving Kentucky ill-prepared for future economic downturns. On behalf of children and families across the great state of Kentucky, Save the Children Action Network urges lawmakers, especially the members of the Senate Economic Development, Tourism, and Labor Committee, to prioritize the well-being of Kentucky's children and families by rejecting House Bill 367 and voting no to protect the future of our state.
Thank you, Sarah. Now we'll hear from Tanya Whitfield with the Kentucky Food Action Network.
Yes, and I'm also on the domestic violence board, and I am also a survivor of domestic violence. And I'm a mom of two beautiful princesses, and SNAP benefits is vitally important for the survival of my family. And as a domestic violence survivor, there's a part in the bill that no one has really talked about yet, and y'all might not know about, but there is a part of the asset test that is really, really detrimental to DV survivors, because as most people know, when you're leaving a DV relationship, you're not trying to like broadcast it to the person that you're leaving. So if you have to go then and talk to the person that you left, because they have to sign an affidavit or paper saying this is the money you have, this is the money they had, that's definitely a non-starter, and we definitely don't need to add more violence to the situation or add things negatively to the situation. And I do understand about working. I've worked my whole life and I still struggle. I struggle financially every day to provide for my children, but I do everything in my power to give them the best life that I can. And that's why SNAP benefits is so vital to that success, because it is government assistance. It is an assistance program. So to take away the assistance because people feel that we're not working enough, I'm working, I'm going to school, I'm helping with different organizations to better my life, to better my children's lives. I don't know what else they feel like we're not doing enough of. And I just thank you for your time.
Thank you. Next up is Jordan Ogile with Feeding Kentucky.
Yes, and I'm joining from Washington, D.C. today with the Food Bank Advocacy Week in D.C., where we're also trying to protect SNAP at the federal level. And I got to say, going at the end of this lineup is constantly asking yourself, how can I top that with each new speaker? 1 in 8 Kentuckians are going hungry, like Dustin said. And this is the third attempt in 5 years to eliminate broad-based category eligibility, to move from an income test to an asset test. And in the committee hearing 2 weeks ago, Representative Williams and his FGA colleague assured us that BBCE elimination was necessary to prevent fraud and abuse. And yet the only case that they could cite, or indeed the only case on the FGA website, was a Minnesota millionaire purposely attempting to defraud the system. SNAP is designed to foster self-sustainability, helps users build savings until they can be weaned off benefits. And under 367, we're going to be cutting the very bootstraps that people are attempting to pull themselves up by. So the one figure that I want everyone to focus on is SNAP provides 9 meals for every one that a food bank does in Kentucky. Where if we slash SNAP in the bluegrass states, that is extra capacity that our already stressed food banks will not be able to pick up. And we need to emphasize in our conversations with senators going forward that Kentuckians are trying to get by. And 2 weeks ago, FGA claimed erroneously that primary vehicles are not subject to the asset test. But according to 7 CR 273, vehicles do count for these asset tests. So the estimates currently that 65,000 Kentuckians will lose their benefits day one under 367 are a gross underestimation. The only exceptions that the USDA allows are if the vehicle is used for a job or if it's over or is used as a home. So I ask you, if the purported intention of 367 is to encourage employment and working, how are SNAP users supposed to get to work? How are they supposed to commute every day if they are forced with the choice of selling their vehicle or eating dinner that night? So I want to clarify that we vehemently oppose any and all restrictions on SNAP at the food banks. We cannot pick up the extra capacity. We want to reinforce that extra nutrition assistance that these programs provide is crucial to the work that we do. And we really caution people from allowing a Florida-based quote unquote think tank to dictate what Kentuckians get to eat and how many of them get to eat. Florida will not be the ones feeling the harms of 367, Kentuckians will. And we shouldn't allow a carpetbagging organization to dictate who deserves food in the Commonwealth. Thank you.
Thank you, George. The final speaker is Todd Smith with the Kentucky Council of Churches.
Thank you. In the parable of the sheep and the goats, Jesus paints an image of the nations coming before his all-gracious throne on the last day for judgment, and him dividing the nations like a shepherd with the sheep at his right hand and the goats at his left. Then he will invite the faithful sheep to inherit the kingdom prepared for them for their faithfulness in serving him by feeding the hungry, giving drink to the thirsty, welcoming the stranger, clothing the naked, caring for the sick, and visiting the imprisoned. Likewise, the goats are called accursed for neglecting Christ by failing to care for the poor and needy that society devalues and sees as the least among us. HB 367 goes a step further. It does not only ignore the needs of the poor, but actively takes away from them what little they already have. To take food from people who are in need for an unjust crusade against the poor is not only immoral, it is anti-Christian. The Kentucky Council of Churches, all 12 denominations, 20 regional bodies, and all of the congregations and members thereof, calls upon the State Economic Development, Tourism, and Labor Committee and all Kentucky state senators to resoundingly and unequivocally reject HB 367. To do otherwise is a sin against God and humanity, the likes of which the Christian conscience cannot allow. Thank you.
Thank you, Todd, and thanks to all the speakers. We got through that in roughly 20 minutes, which I think some committee chairmen might be jealous of our ability to move this quickly. So now we have several reporters on the call, and we can open the conversation up to any questions that you might have. Feel free to drop them in the chat, or you can come off mute and start talking, but now is the time for that. Here's a question from Monica Harkins. She's asked if Tanya could share where she's from and how long she's been on SNAP.
I am originally from Chicago, and I've pretty much been on SNAP since I arrived in Kentucky about 21 years ago.
Tanya, where do you live now?
Oh, sorry. I live in Lexington, Kentucky.
You see that question, Tanya? She's wondering if there's anything else you could share about how SNAP helps.
Yes, sir. I saw it. it helps not only to feed my princesses, but my mom is also on SNAP benefits, and it helps her to eat, which, you know, I've already working with God on keeping my mom alive for another 20 years. And I definitely think food helps with that situation. And it just, you know, because the money, I don't make enough. And, you know, and I'm going to school. I'm in my third semester of college at BCTC, so I can get more education. So I am able to eventually get a better job. But, you know, you have to have the experience to get the job, but then to get the job, you need the experience. So it's kind of like that circle of like, how can I have something before I have something? And so like SNAP really helps with that, because that takes, if I was to lose SNAP, like that would take all of my benefits. It would take just about everything that I have. And then if I had to use the cash that I have to feed my children, yeah, we would be struggling every day.
Are there any misconceptions to being someone who uses SNAP, which Tanya or anyone else can answer? I know Chelsea, you mentioned being a former SNAP recipient. But if anyone wants to talk to that, they should feel free to.
I'll answer that question. Dalla Emerson here. I have several of my employees who are on SNAP benefits, and we would love to pay them a livable wage. But the way the inflation is right now, price of gas, groceries, rent, utilities, I have several employees that I'm on a daily basis trying to find help and assistance, and they're already on SNAP. And there's a huge fear that they find a second job, that they would lose their benefits. Several of my employees already work 2 jobs and still qualify for SNAP benefits because they are low income jobs. A lot of my team members have children that are in our district, and they are being fed in our district, and that helps them at home, but on the weekends is also a struggle. And it's heart-wrenching for me hearing the stories of my team members when they are going hungry over the weekend because they had to pay a light bill instead of buying groceries that weekend. The misconception is that people are at home flipping Netflix and, you know, eating off a SNAP. SNAP doesn't make anybody hungry. I mean, anybody rich. It's not a cash cow. It is a lifeline. And most times the lifeline doesn't even support what their needs are. It's a very minimum amount of money that they receive. So taking away that lifeline is going to impact the Commonwealth in a way that we're not prepared for. No food bank, no school system, no church pantry. No, we are not prepared for the assistance that's going to come if we take this away.
Go ahead, Dustin.
Yeah, I think Dalla said it. Just a couple statistics that might be helpful in illustrating that point is that the USDA says that food insecure households participate in the labor force at the same rate as the general public, which makes sense because you have to work in order to eat. So SNAP is in many ways a work support. There's a 1 in 4 chance that the cashier who's helping you purchase your groceries is using SNAP to purchase her own, for example. So I think it's really important that folks remember that SNAP is helping to feed working Kentuckians. And that anytime we talk about needing to get people back to work, you know, we're not talking about SNAP participants any more than we're talking about anyone else.
Thank you. I think Todd has something to add to this too.
Yes, one of the main misconceptions about SNAP that I'm aware of is that it is people somewhere else who receive and participate in SNAP. But SNAP participants, SNAP recipients are members of all of our communities. They go to the school with your kids. They live in your neighborhood. They worship with you on Sunday morning. They are people that you love. They are people that I love. And they are people who are actively taking a part in their communities. It is so easy for us to overlook people because poverty can often be a thing that forces folks to suffer in silence. However, folks who receive SNAP are our friends and our neighbors.
Something else I'll say from the narrative standpoint surrounding SNAP is there is a misconception that, you know, the American dream, that if you work hard, you can make it. And a lot of times with these bills, there's the context of if you haven't made it, you must have not worked hard. And that generates this idea that the working poor are lazy and need these sorts of legislations to get them off the couch and into their cars and out the door. And that's simply not true. For Kentucky, 95% of SNAP participants are either retired, disabled, or working. So measures like this in an attempt to galvanize SNAP participants are redundant, administratively burdensome, and are based in a really harmful subtext that just isn't true. And the other thing I'll say surrounding SNAP as a message is, like Todd said, these are our neighbors. And as we slash SNAP at the state level or even the federal level, the narrative is we're saving the state money. We're saving SNAP as a program money by reducing registration rules. But that is money that is spent down the line. There are $16 trillion spent each year on healthcare related to nutrition-related diseases and illnesses. This is money that, sure, we may save money for SNAP at the Kentucky House in Frankfurt, but we will feel that down the line in our hospitals. We'll feel that down the line in our schools. This is money that we spend in dividends down the line.
Tanya, go ahead and you can speak.
Yes, and that's where it's always frustrating to me, because I've always been a hardworking person. And that's why it really bothers me when people say, well, you're just not working hard enough. You're just not doing enough. You know, I just recently got my GED in 2022 of December, and it took me 4.5 years just to get my math. And I'm not ashamed to say that. I worked very hard. I just learned differently, but that doesn't mean that I can't do it. And that's the zeal that's in me, that I keep going. And people will ask me, why did you keep going? Why didn't you just stop? Because that's not in me. So you can work as hard as you can and still not make enough. And that doesn't mean that you didn't work good enough or you didn't try hard enough, because that's not ever the case. If it was just off my work ethic, I would be a billionaire, but that's not how that works. So, you know, it's just, and when it comes to the fraud, that is just insane, because it's so low, the fraud that supposedly they're talking about. And I'll even give you an example of the fraud that they're supposedly talking about. And please, if anybody else has never done this in their whole life, please tell me. So they was talking about in House Bill 7, which how we got rid of that, because they said one thing about fraud that they were worried about is say you go to the grocery store and you forget some items, because nobody ever forgets items in the world when they go to the grocery store, and they go back to that same grocery store to get those said items. They call that fraud. So please tell me if none of y'all ever forgot anything in the grocery store and went back to the same grocery store to get said items.
Thank you, Tanya. Well, I'm not seeing any more questions, but we still have some time if there are any. One thing that maybe Dustin, you could do for the benefit of the reporters listening is just a quick rundown of where this bill stands at the moment.
Yeah, so House Bill 367 passed out of the House Families and Children Committee on partisan lines. And then it passed out of the full House with bipartisan opposition. I think the total vote count was 61-33. So it is now in the Senate. It was sent to the Senate Economic Development, Tourism, and Labor Committee. It had a hearing without a vote last week. And as of this morning, it's not on the agenda for tomorrow. So we are hoping that's where it stays, and that we continue to have a program that has as few barriers to participation as possible.